160 crazy liver and gallbladder flushes, lots of insight and all the essential information. Disclaimer. The recommendations in this presentation are not intended for cancer patients, babies, small children, pregnant women, or the elderly, 70 to 75 years old and above. Liver and gallbladder flushes are very effective, but also entail significant risks. Please read all instructions very carefully. History of Liver and Gallbladder Flushes from Energy.com by Andreas Moritz. Ayurveda, the ancient Indian system of medicine, knew how to use oil to dispel toxins from the liver and gallbladder. Ancient Egyptian texts also describe ways to detoxify the body via the liver using oils. In more recent history, both English and German medical textbooks of the 1920s and 1930s describe what happens when you take a mixture of oil and juice to dispel clumps of matter that are green-colored and float in the toilet. Fast facts on the liver and gallbladder from Medical News Today. The liver is the largest solid organ in the body. Weighing 1.44 to 1.66 kilograms. The liver is roughly triangular and consists of two lobes, a larger right lobe, and a smaller left lobe. The liver carries out more than 500 roles in the human body. Unlike most organs, the liver has two major sources of blood. The liver is the only visceral organ with the capacity to regenerate. The gallbladder is a small hollow organ where bile produced in the liver is stored and concentrated before being released into the small intestine. Wikipedia, Liver and Gallbladder Flush Benefits. Liver flushes can dissolve the intrahepatic stones and cleanse the liver. It regulates the digestive system functions. By unblocking the liver, you initiate the regeneration of liver cells, which enables the entire body to rejuvenate. The kidneys are directly related to the liver with many complementary processes. By opening blockages in the liver, renal kidney functions improve. All inflammations in the body are directly related to liver and kidney functions. The metabolism of the entire body shows considerable improvement. The main risks of liver and gallbladder flushes, my review. Liver hepatic stones, made of solidified bile, might move and block the bile ducts. This may create a condition that will bring you to the emergency room with nausea and vomiting accompanied by fainting and dizziness. Patients with digestive system inflammation like Crohn's disease or colitis and patients with liver disease cannot do this liver flush treatment until they are sure that their intestinal tract is not blocked due to long-term inflammations, preparations and initial requirements. It is recommended to follow the lifestyle recommendations and balanced diet guidelines for at least 14-30 days. Detailed on the next slide. Perform 3-5 successful coffee enemas, without incurring significant side effects, like fever, nausea, vomiting. A short video is available on YouTube. Coffee and baking soda enemas, all the essential information. After you have completed all the requirements, you will be ready to do your first liver and gallbladder flush. Initial lifestyle and diet recommendations. Try to minimize your medications intake. Smoking and alcohol are not recommended. Avoid any processed food and soft drinks, including diet drinks. Reduce the intake of animal protein, mainly meat and dairy products. Reduce the consumption of sugar and white flour products. Each morning on an empty stomach squeeze 1 lemon and drink it mixed with lukewarm water. You need at least 7 hours of continuous night sleep, the second step before performing a liver flush. 7 days before a liver flush. You have to drink every morning 2 full tablespoons of apple cider vinegar with lemon juice and lukewarm water, on an empty stomach. Apple cider vinegar contains malic acid that can dissolve bile stones inside the liver. Perform at least 2 coffee enemas in the same week, before you do a liver flush. On the day you do a liver flush, it is recommended that you eat light food. You cannot eat after 13 p.m. to prevent toxins or other residuals from getting stuck in the intestines. It is recommended to perform a coffee enema before starting the liver flush. It clears the intestines, supplies Epsom salt, magnesium sulfate, 60 grams. Medical grade. 2 grapefruits. Red grapefruits are the best. 1 lemon. Organic if available. Apple cider vinegar 2 tablespoons. My addition to improving emulsification. 1 small cup, 150 to 200 milliliters, of cold-pressed extra virgin olive oil. Lower acidity, less than 0.5%. Glass jar. Wooden spoon. For mixing. Hot silicone or rubber bottle. Coffee enema supplies. Recommended. Probiotic of living bacteria enema. Recommended, first time performing a liver flush and the best timing. I recommend starting with half the quantity of juice and olive oil. So you will have only 3/4, 1 cup of mixture instead of 1.5 to 2 cups. Just if there are no significant side effects, like high fever, you can move on to using the recommended quantities given in the supplies slide. It is wise to do the liver flush on the weekend because you may have a slight fever the day after doing it or you may feel tired. Liver and gallbladder flush detailed instructions. On the same evening that you perform the liver flush, put the Epsom salt, magnesium sulfate, 60 grams in a clean glass jar. Pour 3 cups of clean filtered water into the jar. The temperature of the water should be lukewarm. Stir well with a wooden spoon. It is now Epsom salt solution. At 1800 hours, drink the first 3/4 cup of the Epsom salt solution. The taste will be bitter. You can drink pure water after drinking the Epsom salt solution. At 2000 hours, drink the second 3/4 cup of the Epsom salt solution. You should make the following arrangements to enter bed at 2200 hours. Put pillows or somehow lift the back of the bed so that you can lie in an upright position. Brush your teeth. After you drink the mixture, you cannot move for 1 hour. The Epsom salt might cause urgent urination. It is best to go to the bathroom to empty before drinking the mixture. Prepare the hot bottle, with boiling water inside a rubber or silicone bottle. Make sure you close the cork tightly. It is necessary to warp the hot bottle with a clean towel to prevent burns. Same night at 2200 hours, preparation of the mixture. Squeeze the grapefruit juice and filter it using a fine mesh strainer to get a clear juice. You need about 3/4 of a cup. Squeeze 1 lemon and filter the juice using a fine mesh strainer. You can add the lemon juice to the grapefruit juice. Add 2 tablespoons of apple cider vinegar to the juice. If necessary, divide the juice and apple cider vinegar mixture into 2 identical cups. Add olive oil to both cups. The quantity of olive oil should equal the amount of juice. Stir well with a wooden spoon. Drink the mixture within 5-10 minutes. After drinking the mixture, you have to relax in the bed with a raised back. You might feel nausea immediately after drinking the mixture. It is recommended to put a bowl and a second towel next to your bed, just in case you need urgent vomiting. After you enter the bed, you should put the hot bottle wrapped in a towel onto the liver. 1 hour after drinking the mixture, you can get up from the bed. In case you need to go to the toilets, you will feel tired. If you can sleep, it is best to do so. You might feel intense pressure in the digestive system to defecate. Do not fight this feeling. You should go to the toilet and empty your bowels, in the morning and during the day after the liver flush. Between 7 o'clock to 8 o'clock, drink the third, 3/4 cup of the Epsom salt solution. You might have an immediate discharge of green intra-hepatic stones over the night or the next morning. The next morning between 6 to 8 a.m., it is recommended to start with the baking soda enema. Performing a coffee enema might remove more hepatic stones from the bile ducts. Probiotics of living bacteria enema are also recommended. After completion of the coffee enema at about 10 o'clock, drink the fourth, 3/4 cup of the Epsom salt solution. Having a case of light diarrhea is not unusual, due to the Epsom salt. You should eat lightly and refrain from intensive physical activities. Maximum frequency for liver flushes and how long it takes. The maximum frequency for performing liver flushes is once every 2-4 weeks. The big question that every patient asks is how long does it take, and how many liver flushes do I need? The answer, of course, is individual and depends upon the condition of the liver and kidneys, your age, gender, your lifestyle, and your self-discipline. However, non-kidney or liver disease patients can expect to perform 6 to 12 liver flushes, which means that it might take 6 months to 1 year to complete the treatment. Patients with liver or kidney disease might need much more than that, when to reduce the frequency of liver flushes and stop. Listen to your body. When symptoms are improving, you can reduce the frequency of liver and gallbladder flushes. Improving blood circulation in the liver, and the flow of bile to the intestines will result in the following: frequent bowel movements, improved energy. Many annoying symptoms show significant improvement. The blood tests will show gradual improvement. Stop liver flushes gradually after most symptoms disappear, the ultimate detoxification. Why combining freshly squeezed juice with liver and gallbladder flushes and coffee enemas is so powerful. Fresh juicing supplies the body all the needed nutrients such as vitamins, enzymes, electrolytes and antioxidants. It elevates the body's energy and helps the liver to produce more bile. Liver flushes, especially when adding apple cider vinegar, can help with dissolving and removing of solidified bile stones that are a result of high levels of toxicity. When the bile ducts are not blocked, coffee enemas are much more effective, because the movement inside the liver is through the bile ducts. Coffee enemas have an almost immediate effect on the liver and intestines. When the body has low levels of toxicity, the body's energy will improve significantly. Therefore, the immune system can fight all pathogens much more effectively. Summary: due to my extreme liver disease, HCV, I have performed more than 160 liver flushes along with 3,000 double coffee enemas and daily freshly squeezed juice for the past 7 years. Liver flushes can dissolve the intrahepatic stones and cleanse the liver. By unblocking the liver, you initiate the regeneration and rejuvenation process. Liver flushes entail many risks. It is essential to follow all the instructions and guidelines. For patients suffering from chronic inflammatory diseases, liver flushes are usually not enough. Combining the freshly squeezed juice with coffee enemas and liver flushes will help to achieve the ultimate detoxification. The full article is available on the following website, sfhealing.com, Treatments and Auxiliaries chapter.